Good day everyone, my name is Angel Arlibres from BSN 212C and I'll be performing the subcutaneous parental administration method demonstration. This is a way of administrating drug or the administrating the medication through the adipose tissue beneath the patient's skin. We'll be doing this by inserting an insulin needle, an insulin syringe with the medication inside through the subcutaneous tissue beneath the patient's skin using a 45 to 90 degree angle. So before we start the whole procedure, we should first check the doctor's order and also check the MAR to make sure that the right medication will be administered to the right patient with the right dose, right route of administration, and right frequency. Alright. So the next thing we're going to do is also to check the name of the label of the medication. So we're going to take this to check if the right medication will be administered to the patient. Also, as you inspect the medication, the label of the medication, you should also check for the expiration date of the medication to make sure that the medicine is not yet expired before it will be administered to the patient. Then the next thing we're going to do is to follow 3 checks before administering the medication. The first is to check the label of the medication after we got the medication from the medication part. The next thing is to check the label of the drug before withdrawing the medication from the ampule or the vial. Then also, the third is checking the label of the medication after you withdraw the medication from the ampule or vial. Then the next thing you're going to do is to organize the equipment that will be needing to use as we go on to the whole procedure. First is we already have the doctor's order and the MAR here. We also have the medication ticket. We also have the medicine tray here. We have our insulin syringe, our cleaning gloves. We also have our trash receptacle here, including the sharps receptacle. We also have our alcohol here, our dry cotton balls, our cotton ball soaked in 70% alcohol. We also have our cotton pad here. Then we also have our sterile water, which will serve as the medication for this demonstration. Now, before we start preparing the insulin syringe, we should first perform the hand washing procedure to deter the spread of microorganisms and to prevent infection and cross-contamination. Then the next thing we're going to do is to prepare the vial for the drug to be withdrawn. So we're going to put that in our medication tray. Then the next thing we're going to do is to remove the protective cap of the vial from the vial itself. And then, after you remove the cap of the vial, you're going to throw this in our trash receptacle. And now, since the rubber cap is already exposed, we're going to take the alcohol pad and clean the rubber cap by doing it in a circular motion from the inner to the outer to prevent contamination. After that, we're going to take out our insulin syringe. And then, since it is said that we're going to administer 0.4 cc or 0.4 ml of the medication, which is according to the patient's doctor's order. So what we're going to do is to draw the same amount of air that with the same dosage that you'll be administering to the patient. So we're going to so here are going to hold down the vial, and then you're going to insert the needle at the center of the vial to maintain the sterility of the needle, and then you're going to draw the air inside the vial, and then you're going to invert the vial, and then you start withdrawing the medication. Alright. And also remember to never do recapping of the syringe for us and also for you to prevent any needle prick injury. So what you're going to do is to do the fish hook method, which you're going to close the cup of the insulin, and then you close it like this. After you have prepared the medication in the insulin syringe, you're going to put that in our medication tray, and then fill up the medication ticket. So you're going to input the name of the medication, the dosage of the medication, and also the route of administration. We're going to take the medication ticket and put it in here. Then we're going to throw this in our trash receptacle. Now that we have already prepared the medication, what we're going to do next is to administer the medication to our patient. So let's assume that we are standing in front of the patient's room. What we're going to do next is to knock first before entering the patient's room. So now that we're in the patient's room and now we're carrying the medication, let's first set up the bedside table of the patient. Okay, now I'll be adjusting the camera angle so that you will see the patient. Okay. So now before we start the whole procedure, we should first Do the hand washing again to deter the spread of microorganisms and prevent infection and cross-contamination. Since we have already washed our hands, what we're going to do is just pour some alcohol in our hands. And what you're going to do next is to introduce yourselves to the patient and explain the procedure for her to have full understanding to what we're going to do to her and what we're going to administer to our patient. So, good day, ma'am. My name is Angel Arlibres. Can I serious ka, ma'am? Alright, so please state your full name. Your birthday, please. Alright. So, how would you like me to call you, ma'am? Ma'am Camille would be fine. Okay, Ma'am Camille. So, before we start the procedure, what language do you prefer speaking? What do you speak? Tagalog, English, Bisaya? You speak all of the language that I have read. Oh, okay. But you speak mostly Bisaya. Okay, so I'll explain more on Bisaya and also I'll explain in other language as well. Would that be all right with you, ma'am? So, ma'am, nga kung buhaton ka, ay, nga ako dali karon sa imong atubangan kay, according kay Dr. Suarez, imong physician kay, na siya pa-administer na tambal sa imong ha, which is na sa imong doctor's order. And what ang buhaton na ako karon, ma'am, is mag-inject ko sa medication na ginoo ni doc sa imong ha, sa imong subcutaneous tissue. So, magtusok ko dira sa imong abdomen, ma'am, ay maka-feel kag mura. Gamay lang na prick, ma'am, then medyo uncomfy po siya sa feeling, ma'am. But nawala na po siya pagkaon niya. Medyo sakit-sakit siya, ma'am, since magtusok mo na ko ng syringe, ma'am. Oo, according kay Doc, maayo daw ka, ano. Effective daw siya na tama, hindi ka. Okay po. So, next po, ipababa na po ang imong blanket niya, ma'am, ha, pag mag-start na ta. Okay. Now that we have already gained the patient's approval for us to administer the medication to her, what we're going to do next is to provide patient's privacy by closing the windows and closing the doors. Now, the next thing we're going to do is to bring down this blanket to expose the area, the injection site that we have selected. And also, as we try to select for the injection site, we should also inspect for any lesion, for any redness, for any tenderness, hardness, or swelling or inflammation that you may have feel on the area. So, at the same time, we're going to wear our gloves, which serves as our protection. Protection from bodily fluids, and also to avoid cross-contamination between me and my patient. Wait lang po, ma'am, ha. Magsuot lang po ako ng gloves. Alright po. Okay. Hanggang ka po matapos. Okay, so as I can see from here, I don't see any inflammation though, but yeah, I'm going to palpate the patient's abdomen area where I have selected for the injection site to make sure that there is no inflammation or swelling feeling in this area. Alright. Now that we have made sure that there are no such findings in the patient's abdomen, and what we're going to do is to prepare, assist the patient to a comfortable position if she is uncomfortable. So, ma'am, comfortable pa sa imong position karon, ma'am? Comfortable ka? Kasi gusto ni mo na mahigda, jud, ma'am. Gusto ni mo tanggalan ako online? Sige, sige, sige. So assist the patient if ever she has any concerns about her positioning. And then we're going to set this aside since the patient is more comfortable lying in a supine position. Also, we have to make sure that if the patient is uncooperative, we can obtain assistance from her guidance. Now that we have already exposed the patient's abdomen, what we're going to do is to prepare the medication. But first, we're going to clean the injection site by using a cotton ball so it cleanse 70% alcohol. And then you're going to clean the injection site from inner to outer by using a circular motion. Then we're going to do this for like 5 centimeters, or we should take note that the distance where we're going to clean the injection site is 5 centimeters or 2 inches. And then after that, we're going to close this container filled with soaked cotton balls, and we're going to take out dry cotton balls and put it in between our third and fourth finger. And now we're going to prepare the injection site by stretching the site that we're going to administer the medication. We're going to slightly squeeze the area, and then we're going to uncap the syringe, and then we're going to hold it between the thumb and the forefinger, or the forefinger, like this, and then slightly squeeze the injection site, and then you're going to insert the needle using a 45-degree angle like that. And then, in order for you not to be not to feel in difficult as we administer the medication, you can let go of the injection site, and then you hold the barrel with your non-dominant hand and hold the plunger using your dominant hand, and then you slowly administer the medication inside of the chosen injection site. Alright, now the medication is already inserted in the adipose tissue. And what we're going to do next is to slowly remove the needle the same angle, and then you're going to put a firm pressure in the injection site. If ever that the injection site is bleeding, you have to put pressure. Since I am having difficulty in trying to put back the cap of the syringe by using a fish hook method, I'm going to dispose it in my trash receptacle. Like that. And then, as we're trying to apply a gentle amount of pressure in the injected area or the injected site to prevent bleeding, we're going also to advise the patient to not rub or massage the injection site, because there might be difficulty of the body to absorb the medication. So, ma'am, Since medyo sakit-sakit mo ng feeling nga na, syempre, kasi i-massage mo, ayaw dyan na siya i-massage ma'am kay para mas effective ang pag-absorb sa imong adipose tissue sa tambal na gihatag, ipahatag dito sa imo. So, ayaw na siya i-rub and ayaw na siya kaluta and mawala ra ng sakit na feeling pag unya-unya pa jud mo. Okay. So, okay, ma'am. Since I have already administered the medication to the patient, I'm going to pull back the blanket that I have pulled down on her to expose the adipose tissue, the abdomen area. And what we're going to do next is to dispose the materials used. I'm going to dispose this. That. And then what you're going to do is to do the aftercare of the materials that was used. But before you leave the patient's room, you should first ask the patient if she has any clarification or she has any question to the nurse on duty. So, ma'am, before ko makawa sa kwarto, ma'am, lain pangutan na or kasi nakay concern na gusto niyo ingon sa amuang. Wala na sa kwarto. Gusto mo na po magpahinga? Okay po. Sige. Ibilin, mag-alis na kami, muhawa na ni Ma'am ha. So, paunsa na ako kung gamit ng bed. Muhawa na po to din. If ever man na yung question lang, pwede na mo subuan ng imong guardian mong pala. At tuan mi sa nurse station din. Pwede siya makatana sa mukha. Okay na po ba yun? Sige. Sige, Ma'am ha. So, mag-clean sa ako dali amang then, kayaan na kita, pasadal, di ka mag-rest dira, ma'am ha. So, sige ma'am, naalis na po ako ma'am. Thank you po sa inyong cooperation. Okay. So after we leave the patient's room, we should remove the gloves that you have used, do the aftercare of the materials that was used in this procedure. Remove the gloves, like that. And then throw it in our trash disposal. Also, the next thing you need to do is to perform again the hand washing procedure to deter the spread of microorganisms and to prevent infection and cross-contamination. This is also a way of removing bodily fluids that may have come in contact with your skin as we do the demonstration. So the next thing we're going to do is to document everything in our NAR. We're going to, what we're going to do is to record the name of the drug that was given to the patient, the time it was administered to the patient, the dosage, the route of administration, and the frequency of the medication. Okay. Now that you have already documented the records in our patient's MAR or the medication administration record, what we're going to do next is to wait and assess for the effectivity of the medication that we have administered in the patient's subcutaneous tissue. And that's all for the subcutaneous parental administration method demonstration.